Good morning, everyone. That was a weak good morning.
Good morning.
Good morning. I'm sure you all know the governor's state address is today, and so I will be leaving right after this to head to Annapolis. But first, we have some very important announcements to make. First, we're going to talk about a new rule that will affect SNAP benefits. SNAP is a critical resource in Baltimore City with approximately 166,000 residents receiving SNAP benefits each month. These numbers have dropped by nearly 20% since 2015. Approximately 9% of SNAP participants are between the ages of 18 and 49 who are not disabled and who do not have dependents. Many of them work but less than 20 hours per week. The technical language for this group is ABAWDS, it's able-bodied adults without dependents. Many able-bodied workers without dependents are hard to employ because they are formerly incarcerated, apply for jobs but are not hired, have undiagnosed disabilities, or are underemployed or seasonal employees and do not meet the 20-hour per week requirement. Many have children or older family they provide for, but may not be the primary caregiver or live in the same household with them. A new rule from the federal level will impact how able-bodied workers without dependents can receive SNAP benefits. As of April the 1st, ABAWDs can only receive SNAP for 3 months out of a 36-month period. Assuming most able-bodied without dependents stay on SNAP for 3 months starting April the 1st, that would mean on July the 1st, they will no longer be on SNAP and could not receive benefits again for nearly 3 years. We estimate that the upcoming ruling will remove an additional 11,000 to 15,000 adults from SNAP in Baltimore City alone. This loss of benefits will result in $24 to $33 million of SNAP disappearing from the local economy each year. This will impact our supermarkets, public markets, farmers markets, and other places where people spend SNAP benefits to buy food. For retailers that serve our lowest income population, this economic hit could be devastating. It will further strain food insecurity, increase healthcare costs, and place extreme burdens on our social safety nets and state and city agencies. So I want to tell you what we have been doing on it in the face of these impeding hits to SNAP. We're supporting the class action suit by DC's Attorney General to file an injunction against the able-bodied without dependent rule. My Food Policy Director, Holly, here with us today, submitted a declaration in the suit. We've been speaking out against these rule changes with multiple people in my administration, myself included, submitting comments to USDA. Just last week, as co-chair of the United States Conference of Mayor Food Policy Task Force, Mayor Bowser and I convened a session on threats to nutrition and food security, SNAP, and the role of mayors at the U.S. Conference of Mayors winter meeting. This rule puts cities like Baltimore in an unrealistic position to meet the needs of residents in the face of unemployment and insufficient jobs. Now I will turn it over to Rick Rogers, the Chief Operations Officer for B. Green and Company. Rick.
Thank you, Mayor. I kind of wanted to shed some light from a retail perspective. We know it's going to be hard on the families of Baltimore, but it's going to be tough on the business as well. We're a 105-year-old company. We're locally owned, locally operated. We have 2 stores in Baltimore City, Food Depot. We also have 2 cash and carry locations, which service a lot of other retail operations and businesses in Baltimore City as well. To give you a little bit more perspective and impact, an average grocery store works on 1 to 3 cents profit per dollar earned. That's a very slim margin, so there's not a lot of room for error. So when you're looking at that compared to other businesses that work on much higher margins, you can see the impact that this is going to have on the grocers, especially in Baltimore City. The typical grocer nationwide, only about 4 to 6% of their income that comes in is derived from SNAP. You know, that's the dollars that come in. So every dollar that's spent, 6% is SNAP. My 2 stores in Baltimore City, that number is 50 to 55%. So that's almost 10 times the national average. So you can see the impact where if you're out in the county, it's still going to impact a person, whether you're one of 12 or one of 15,000, it's an impact. But the impact on businesses is going to be much higher. Some of the unintended consequences that we're looking at as well is if you're looking at less revenue, you're going to have to cut potentially expenses. What is that going to be? Jobs. And this is really what this is supposed to do, create jobs, and in actuality, it could be taking them away from a retail perspective. The other thing you're looking at is that we are probably going to have less services, and that might mean more self-checkouts, procuring product outside instead of doing that in the store, cutting meat, seafood. And really, the bottom line is it's going to be tough for retailers in the city, and you're going to see stores that are possibly going to close. And all that's going to do is just further enhance the food desert situation that we already have. So, the impact is real, and I ask you to listen to, the folks that are speaking about these points because they are affecting Baltimore City critically. To talk a little bit more about that, I want to introduce the President and CEO of the Maryland Food Bank, Carmen Del Guecho.
Thank you. Good morning, everyone. My name is Carmen Del Guecho, President and CEO of the Maryland Food Bank, the state's largest charitable food provider. The Maryland Food Bank is the hub of the food assistance safety net in our state. Through a statewide network of soup kitchens and food pantries, shelters, senior centers, and other community organizations, we distribute enough food to provide 40 million meals to Marylanders in need, while at the same time working hard to address the root cause of hunger so we can end hunger for good for more people. It's work we've been doing for over 40 years, but the one thing we've learned during that time is we cannot do this work alone. Programs like SNAP also play a critical role in our fight against hunger. For most people, it's the first line of defense. To provide some context, for every meal we provide, SNAP provides 9. It's the lifeline for thousands of Marylanders struggling with food insecurity, giving them and their families a fighting chance for a better future. And that's why we have no doubt that this new rule that viciously targets individuals who are most in need of help, people who are unemployed and without access to resources, will negatively impact our organization, as well as our network of community partners and those we serve. If this rule is implemented on April 1st, the hundreds of community partners we work with will no doubt see many, many more faces coming through their doors each and every day. The premise behind this change is that able-bodied adults are making the conscious decision not to work, preferring instead to rely on SNAP benefits to provide for themselves and their families. Well, what many people don't realize is that SNAP benefits for the average recipient amounts to just over $4 a day. Certainly not enough to provide for their families. So the question becomes, will denying access to much-needed nutritious food suddenly make someone more employable or increase their access to good-paying jobs? As the mayor said, the reality is that many of these individuals impacted by this rule change are struggling to access jobs not because it's a lack of effort, but rather due to a number of other factors. Many lack the necessary work skills. Many lack necessary education. They may be homeless. They may lack basic transportation or face challenges getting back in the workforce thanks to barriers like a criminal record. Others are living with health conditions that make working full-time difficult, or that they may actually have work, but those jobs are unstable with fluctuating hours and poor benefits. This rule ignores people caring for elderly parents while out of work, or people who are looking for work but no longer live with their children, yet are still trying to make sure their kids have something to eat. In fact, taking people who are unable to find jobs off SNAP will harm more than just those who directly receive food assistance. Many of these people share their benefits with their family, including children and elderly family members, and the ripple effects of planned cuts will undoubtedly hurt this larger group of people as well. Let's not forget that the purpose of SNAP is to address hunger and provide access to more nutrition food. It is not a work incentive program. There's plenty of research available showing that work requirements do little to help unemployed people find jobs and instead make it more difficult for them to feed themselves, which often lead to other costs like health care. As I mentioned, last year we distributed enough food to provide over 40,000 meals. That's over 110,000 meals a day. In Baltimore City alone, we reach hungry residents through targeted food assistance programs at 477 community organizations, providing over 9.5 million meals into the city. In an effort to focus on long-term root cause solutions, we also run a program called FoodWorks. It's a culinary training program, a culinary training and job placement program available to low-income individuals who learn valuable skills while producing meals for families in need. Even with this workforce development program and all the other things we do, all our channels are fully flowing at this time. Yet we know that those who are cut off from SNAP will become more dependent on the same network of food assistance. And to put it bluntly, the impact of SNAP is significantly higher than what the food assistance safety net is capable of absorbing. There's simply no way we will have the resources to address this widening gap. Taking SNAP benefits away from individuals who are already barely keeping their heads above water, this rule will just plunge them beneath the surface again. And at the same time, it'll put added pressure on not only on household budgets, but on a hunger relief network that's already operating at maximum capacity. Thank you, and now I'd like to introduce Michael J. Wilson from Maryland Hunger Solutions to talk more about the impact of this rule.
Thank you, Carmen. My name is Michael J. Wilson. I'm the director of Maryland Hunger Solutions. It's a Baltimore-based statewide organization that does outreach to help alleviate hunger in the state of Maryland. We do outreach where we actually sign people up for SNAP in every part of the state. And we do advocacy to try to improve hunger policies and anti-poverty policies that have an impact on people in the state of Maryland. The biggest problem is this is a policy that's being pushed forward by the administration, which was never intended to be administered the way they're attempting to administer it. They have taken away the local control and the local supports that states all around the country have been doing. In the state of Maryland, as the ABOD policy has expanded, the state has done a good job of managing it and exempting jurisdictions that had challenges like Baltimore City. This policy takes the state's ability to do that away and forces Baltimore in a very difficult situation. So as other folks have said, the people who are going to be most challenged by this are folks who are the hardest to employ. And they're not just blank faces, they are real people. So I can tell you about Alton Royal, who we helped sign up for SNAP at the Franciscan Center here in Baltimore City, formerly incarcerated. Alton didn't finish high school. He's been injured, but he's looking for work. And Alton would love to have a job, but given his situation, it's been difficult for him both to find or to keep a job. I can tell you about another gentleman who didn't want his name used, who works a seasonal job at the Baltimore Orioles. And so when the Orioles are in town, he's working. And when they're not, in off season, he's scrambling to do the best that he can. The biggest mistake is for anybody to call these work requirements. They are not work requirements. Most SNAP recipients who are not seniors, children, or disabled are already working. They're just not earning enough money to escape poverty, and that's why they're SNAP eligible. These are time limits. These are artificial time limits imposed on them, even though we know they're eligible for SNAP, and it's going to take food away from them. There's no good reason to take food away from people who we know are eligible from the program and to make them struggle even harder in a tough, tough situation. And so we're glad that the Attorney General in DC and Brian Frost here in Maryland have filed suit to stop this. We think there's a good chance to do that, but we know there are other regulations coming down the pike and we need to be able to fight against them too. And so we appreciate your support, Mr. Mayor, and the city in order to try to help the residents here in Baltimore. I'm going to turn it over now to Holly Freistadt, the Food Policy Director for Baltimore City.
Hi, everyone. This concludes our press event related to SNAP and ABODs, but I wanted to field any questions that the press may have.
Give us kind of a typical profile, if there is one, of the recipient of this particular benefit.
So Michael J. Wilson just gave 2 examples, but I'll give you another one. We have a resident food equity advisor. She has applied for 8 jobs. She lives in public housing. She had a good job, she lost it, and she's had a really hard time of getting back on her feet. She does not have children, she does not have any disabilities, and she continues to look for work. And I think that's another scenario is college students. Now, I'm not talking about the typical college student. I'm talking about someone who's living in public housing, who is trying to get on their feet, trying to get better jobs, who's doing online courses, but there's requirements that restrict them from being able to get SNAP unless they work a certain amount of hours. So most of these people, as Michael just said, work. And they're working multiple jobs, or they're trying to find multiple jobs just to get by.
Thank you.
Thank you. Thank you, Mr. Mayor.
Well, next, I know we have all seen the news about the coronavirus and a small number of reported cases in the U.S. I've asked our health commissioner and our emergency responders to brief residents on protocol and preparation made to ensure Baltimore is ready to respond if needed. I'll turn it over now to Dr. Letitia Zarasa.
Good morning. The Baltimore City Health Department, in conjunction with Fire and the Mayor's Office of Emergency Management, have been closely monitoring the outbreak of severe respiratory illness known as the 2019 novel coronavirus. This morning, I would like to take a few minutes to talk about this new virus and how the health department and city agencies are working together to address it. The initial causes of novel coronavirus outbreak were first identified in December of 2019 in people who had exposure to a seafood and live animal market in Wuhan City, Hubei Province, China. The U.S. had its first lab-confirmed case of the novel coronavirus on January 20th, 2020, in a Washington state resident. As of February 3rd, there are 11 lab-confirmed cases in the U.S. Of the 11, 9 were imported cases from recent travel to Wuhan City, and 2 were cases of close household contacts of the lab-confirmed cases. None of the identified cases are in Maryland. There are currently no reported deaths in the U.S. from this virus. The public health threat to Baltimore City from this virus is low, as there have been no cases so far in Maryland. There is also no evidence of person-to-person transmission in the general public in the U.S. The World Health Organization declared a global health emergency on Thursday, January 30th, and the U.S. declared a public health emergency the following day, Friday, January 31st. These emergency declarations are in place because the novel coronavirus has caused serious illness and because there is sustained person-to-person transmission in China. The coronavirus is a large family of viruses. There are common coronaviruses such as HKU1 and others that circulate in the U.S. The MERS and SARS viruses are also part of the coronavirus family. The 2019 novel coronavirus causes mild to severe illnesses, such as pneumonia. There is currently no vaccine for the novel coronavirus, and treatment is supportive. In Baltimore, we are taking the 2019 novel corona outbreak very serious. The health department is actively monitoring the situation as it evolves and coordinating with hospital and other healthcare institutions to ensure that proper screening is in place. We are also working with EMS and 911 to ensure that we have measures in place to quickly identify persons who may be ill. Baltimore City Health Department will continue to monitor the situation and prepare with our city partners, including the Fire Department and the Mayor's Office of Emergency Management. We are also coordinating closely with the Centers for Disease Control and Prevention, the Maryland Department of Health, and our city hospital and healthcare partners. Residents can help by remembering to take everyday preventative actions that are always recommended to stop the spread of respiratory viruses. If you are sick, please stay home and do not go to work, school, or travel. Wash your hands often with soap and warm water for at least 20 seconds. If you don't have access to soap and water, you can use an alcohol-based hand sanitizer. Cover your mouth and nose with a tissue or your sleeve when coughing or sneezing. For those who feel sick with fever, cough, or difficulty breathing and have recent travel to China or other areas impacted by the novel coronavirus, or have been in contact with someone who in the last 14 days have had symptoms from a confirmed case of novel coronavirus, the CDC recommends that you seek medical care right away. Before going to the doctor's office or emergency room, call ahead and tell them about recent travel and symptoms, and avoid contact with others. It's important to note that symptoms that are consistent with coronavirus are also consistent with influenza or the common flu. It is not too late to get your flu shot, and we encourage Baltimore City residents to get a flu shot from their local healthcare provider. You can stay informed by visiting the Baltimore City Health Department's website, health.baltimorecity.gov. Baltimore City Health Department will continue to monitor the situation and work with state and federal partners, as well as local healthcare institutions and other city agencies to protect the health of our city. Thank you.
Thank you. Now we'll take a few questions on this topic. Okay, thank you. Okay. Last week, we launched Clean It Up campaign. The campaign focused on a set of 8 data-driven cleaning initiatives. Again, this is all hands-on-deck effort involving the acceleration of work by multiple city agencies, as well as new collaboration with community partners. In just 1 week since launching the campaign, we have completed about 1,000 new work orders while closing out just over 500 old ones. Part of my campaign is to hold repeat sanitation violators accountable. We have identified individuals and businesses who have received the most sanitation violations in the past year. And today we're going to put a spotlight on them. This is the top 10 list that no one should want to make. As you can see, they have at least 15 violations, and fines amount range from $750 all the way to $22,000. These are the top 10 most cited individuals and businesses from 2019. And it is important to note that this list will be continuous. Some names will come off and others will be added. As far as those on this list, some have already taken corrective action and paid their fines. Some are currently in talks about how to clean up and comply, and some still need to clean up their act. This list will be posted on Clean Stat dashboard. Also, the Mayor's Spring Cleanup has been scheduled, and it will be Saturday, April the 18th. Call 311 to register. Any questions about that?
How many work orders did you say you included?
1,000 new work orders while closing out 500 old ones.
So since we launched the campaign, the crews have closed just over 1,500 work orders in about a week, and of them, 1,000 of them are new ones that have come in, and 500 of them are part of the backlog. So I think we've had some questions about how DPW and how the city's going to stay on top of it. So we've been tracking that, so we wanted to let folks know that that's what we've done since we started.
Do you feel that DPW is appropriately staffed to handle the backlog and all these new cases coming in?
So DPW is devoting a great deal of resources to work on this issue. A number of other city agencies are committing crews to help clean up the backlog. And so that is helping supplement the work. And I believe that this morning on the Board of Estimates agenda, we approved an addition to one of our mowing contractors so that they can do additional work mowing and clearing some lots for us.
This is kind of a random question, but you did mention this last Wednesday that often drug dealers are hiding their stash in some of the alleys. We went out yesterday and we had some drug dealers yell at one of our crews when they were filming an alley. Is that an additional concern for the city right now, something that you're trying to address?
Yeah, so I think one of the things that we are working on is working with the Department of Public Works to identify places where that is one of the particular challenges to cleaning, and partnering with our law enforcement partners to provide support so that we can work on getting those alleys clean and having longer-term solutions.
So the biggest offender up there is Plus Jones Company, P&J.
Well, they're not the biggest offender. They're number 3 on the list. Right, I mean, it's a list, it's a top 10 list, so just, I mean, they're in order of, this list is so this list is a compilation based on the highest number of citations issued in a year.
Okay, so that company has 22,
Yes,
at 22 locations, is that right?
that is correct.
Different locations?
Yes.
So he's a demolition contractor. What kind of citations is he getting?
Do you want to address that?
Sure. So it was 22 locations that are 22 consecutive lots, and it was in relation to the storage of dirt or in a demolition site. So that incident, he was told to clean it up. Citations were later issued, and then within 6 weeks at the most of the citations being issued, the area was cleaned, and everything was put back in order.
So is the issue here that he uses vacant lots that he owns or doesn't own to throw dirt on?
This is the only situation with that company of this nature that I'm aware of, and it was very isolated, but it was city-owned lots, and it was an active demolition site, and additional dirt was brought in. But he addressed it, and we followed up with procurement to take the proper steps.
Do you know how long he's been doing it?
Only a couple of weeks before we caught it.
Are there cameras installed in these areas, or will there be additional cameras installed in some of these areas?
Well, so I think, and Jason can help. We are working with HCD through CleanStat to identify, we've been tracking all of the camera locations. There are a number of different illegal dumping locations where cameras are. Some of them are used for preventative reasons and some are used to actively find people who are dumping and bring cases. And so we're actually, first of all, tracking how those cameras are performing, so to speak, and seeing whether we should be keeping them there or moving them. But second of all, we've also been mapping where we have repeat dumping and repeat violators, and we'll be looking to make some movement based on that. So it's a combination.
And this list is going to be constantly updated?
Yeah, so this is a one-year running list, so we're basically looking at a one-year period, so we'll be updating that. And so, as the mayor said, you'll see some of these companies fall off the list, and then you'll see new ones, although we hope with less numbers of citations coming on the list, and hopefully we'll get to a point where we don't need to have a list like this.
There's a lot of property companies listed on that. Are these violations for things that tenants are doing and that we're citing the landlords for? Or is this actual violation by
It's a combination of both.
Yeah, it's a combination of both. The way citations work is that for a rental property that is tenant-controlled, the tenant is responsible for maintaining the area, and first two citations are issued to the tenant, assuming the property is registered, and we can find out who the tenant is. After that, the citations start going to the property owner so that the property owner can take charge of the situation and get change. And the list is made up of some commercial properties, some single-family detached houses, some row homes, some multi-dwelling unit apartment buildings. So it's the top 10 that's listed there is kind of, a little bit of everything that exists in Baltimore.
Any more questions? Thank you. Thank you all. Okay. Mr. Commissioner?
Good morning, Mr. Mayor. Over the weekend, there were 3 notable incidents of violence, 1 homicide and 2 non-fatal shootings. The non-fatal shootings were on Friday and Sunday. The homicide was in the 2200 block of Saratoga. We believe right now that it was a robbery, perhaps gone bad. In the 2 non-fatal shootings, one Friday was in the 2000 block of Swansea. In the rear, we believe was a dispute between 2 people that turned violent. The other on Sunday, the victim hacked a ride, was hacking, and was picked up by an unknown person and apparently was shot in the car by that perpetrator, who we are working to identify to hold accountable. On a different note, we continue to instruct our police officers to engage with our children and our young people every day. Our Youth and Neighborhood Services Division and Special Operations Section are working with the Mayor's Office and our downtown partners to offer the Squeegee kids with important information on job opportunities and resources. Under this initiative, we are engaging and assisting Squeegee kids in being offered and accepting employment, and we have worked with the Mayor's Office, and we have done that, and we're hopeful these positive interactions and partnerships will continue while we work to keep them from committing other bad acts of violence while they're out there, and then working to identify those who have already committed bad acts of violence to hold them accountable. Also, in December, the department released its new staffing plan, and we recently released our new community policing plan, both of which are online and out for public comment. You can find them on our website. The staffing plan focuses on key areas: recruitment, staffing levels at all of the districts and specialized units, and talks about the use of civilian staff and technology. It estimates that the department is greater than 300 officers short at this time, could be greater. We have taken great strides to improve our recruitment and retention in the police department, including making significant investments in our new academy facilities, streamlining the curriculum to have more classes, graduate more officers, and put them on the street 8 weeks faster than we were doing last year and in years past. We also focus on our digital marketing campaign to recruit more officers to the police department. But it's not just officers, it's explorers in high school, it's cadets between high school and the age of 21 as a pipeline for employment into the police department. And finally, last year, we saw the highest retention rate that we've seen in 10 years. And we hope to continue that so that we can bring more people on, keep more of our great people here, get officers out there faster so that we can build capacity within the police department.
Any questions?
Yes, when you mentioned the Squeegee kids, and that you're providing information to them, Are you specifically referring them to the office of?
We're working hand in hand with the Mayor's Office of Youth and Family Services, and together, yes, we're offering them informational packets that have information about resources available to them and job opportunities available to them. And we're working with the Mayor's Office to do that every single day.
Mayor.
While we're there, we're working to identify people who we believe have committed bad acts, and we're working to prevent them from committing other acts beyond the squeegeeing act.
Mayor, the other day, the governor said that, to his information, the squeegee workers make $40 to $50 an hour.
I don't know whether that's true or not, but I've heard rumors that they're making a lot of money on those corners. Some say they make $200 a day, some say $100, but it's not all of them making that kind of money. It's just a few that I've heard, but I don't think nobody's making $50 an hour. I wouldn't agree with that.
Commissioner, you know that this is like, you heard on Friday, you presented a pretty detailed plan for public safety in Baltimore, and the first question from a Baltimore County legislator was about squeegee kids. Well, of the interactions that you're aware of, when people complain about the kids on the corner or whatever, what's the percent that are actually an incident of either assault or destruction of property?
Of the complaints that come in, that's actually a very small number. And those are we're made aware of those immediately when individuals call for the police, and we respond either to the scene or somewhere else to meet with them to take that police report. That's a very small number. Of the complaints that come in, it's just for the act of squeegeeing, which is the majority.
Just the fact that they're there and they're trying to
That is correct.
solicit money.
That is correct.
You mentioned in Annapolis, when asked about enforcement, something along the lines of that you were informed that was unconstitutional. Can you?
You know what? That was a gross mischaracterization of what I said, because my answer was about 5 minutes long. I compared it to the panhandling, which the enforcement of panhandling was unconstitutional, not squeegeeing. That is a violation. And I further explained and clarified that when they step into the street, it presents, and these are my exact words, a public safety hazard, which is certainly enforceable. But then I went down the path of explaining the management priorities of using our resources to enforce that, whereby we can't give minors a citation and or homeless people a citation for the mere fact they don't have a bona fide verified address. How do we manage using our resources there versus dealing with all the other index crimes that we're working to prevent and apprehend people who commit them? And so I was very detailed, but I think the caption kind of misled the viewers a little bit.
Anything else? All right, thank you.
Thank you all. Thank you.